Hello everybody and welcome to the Thursday edition of Video Clips. This is an update on the alcohol situation. I've been covering this very disturbing situation where the alcohol industry and the National Institutes of Health are have forged a partnership where they're conducting research to prove that daily drinking is good for you. And I guess I just feel like I should put out information showing you that that's not true. There has to be a counter to this argument because the messages come from what appear to be credible sources. And I hate to say it, it pains me to say this. The National Institutes of Health, not so much a credible source anymore. Well, many health professionals recommend alcohol consumption, claiming that drinking leads to better health outcomes. The problem is it's not true. Some of the misconceptions are based on the types of studies that have been conducted in the past, many of which compared drinkers, social drinkers, to former drinkers. And we all know that former drinkers become former drinkers a lot of times because of health issues ranging from alcoholism to cancer. So I don't think that's such a good comparison group. But the best study, in my opinion, on alcohol is the one that was done comparing never drinkers to social drinkers, and all benefit just went away. Well, a new analysis including 83 prospective studies with almost 600,000 subjects looked at the relationship between alcohol intake and health. And the subjects lived in high-income countries. They were at average age of 57, and they had no history of cardiovascular disease at the start of the study. And this becomes important because this was essentially, I mean, being healthy, air quotes around it, it's a subjective term. You never really know what that means. But these people didn't have cardiovascular disease, and at the age of 57, a lot of people do. They've got markers for, like high cholesterol, high blood pressure, etc. About half of them were consuming over 100 grams of alcohol per week, with 8.4% reporting intake of more than 350 grams per week. The risk of all-cause mortality was lower for people who drank 100 grams or less of alcohol. This is the equivalent of 5 to 6 normal-sized glasses of wine or pints of beer. Subjects with the lowest risk consumed less than 100 grams per week. Increased risk of stroke, coronary artery disease, heart failure, fatal hypertensive disease, and fatal aortic aneurysm increased with more alcohol intake. There was only one inverse relationship, and that was slightly, tiny bit higher than 100 grams, seemed to reduce myocardial infarction, but it was barely statistically significant. The lower risk was greater for people who had lower systolic blood pressure and weaker for people who had higher LDL cholesterol, which goes to my point that these were relatively healthy people, and this same experiment in a population of people like many of our members are when they arrive here, where they're overweight and they take lots of drugs for lots of things, including markers for cardiovascular disease, would probably be even worse. The analysis went on to confirm the findings of several other studies showing that alcohol intake was associated with increased risk of cancers of the digestive tract, and it confirmed prior research showing that life expectancy was slightly shorter for both men and women who drank anything more than 100 grams a week per alcohol. One of the researchers, Angela Wood, said that the findings, quote, support adoption of lower limits of alcohol consumption than are currently recommended by current guidelines. She also said, if you already drink alcohol, drinking less may help you live longer and lower your risk of several cardiovascular conditions. But based on the results of this study, millions of Americans are consuming a whole lot more alcohol than is contemplated as being safe here. I was flabbergasted at this particular statistic, but according to the Centers for Disease Control, 37 million Americans, or 1 in 6 adults, regularly engages in binge drinking. 37 million Americans. The alcohol industry perpetuates this. I mean, and they're partnering with government agencies to show that daily drinking is safe. And I just can't fathom the ethics of starting a trial where you're going to have some people drinking alcohol every day, as ordered by the National Institutes of Health as part of the study. And then seeing what happens over time. I mean, it's hard to get approval for dietary intervention. When we were looking at doing something with the Crohn's and colitis protocol, the people at the university were terribly concerned about what sweet potato lasagna could do to people. I mean, but the National Institutes of Health says part of the study is you have to drink every day. Well, and I'll refer you to the Health Priest Library to read. I've written read about this. I've written a couple of articles, and I won't regurgitate it all here, but it's very, very disturbing. Jason Connor, who's a PhD with the University of Queensland Center for Youth Substance Abuse, says the drinking levels recommended in this study will no doubt be described as implausible and impracticable by the alcohol industry and other opponents of public health warnings on alcohol. And that's another thing that just drives me crazy in this field, is the perception that when we put out accurate information about what people should and shouldn't do if they're interested in health, not from a judgment standpoint, the response is, well, people just won't do that, it's too hard. I don't think it's that hard to avoid drinking alcohol every day. I don't think that's so hard. Now, to be really clear about this, I don't abstain from alcohol, and I'm not suggesting that most people need to do this. But I do think that alcoholic beverages are treats to be enjoyed on special occasions, not consumed regularly as part of a health-promoting diet. There's a difference between something that's in the regular daily diet and something that's a treat. The evidence is pretty crystal clear that what is considered normal alcohol intake and the amount of alcohol that's being promoted as being safe is simply not safe. The facts state otherwise. All right, on to the next thing. There are very few issues about which most people in the healthcare profession agree, and one of them is smoking. I don't think you're going to find very many people who are going to send hate mail to me saying smoking is really good for you. I mean, people really kind of agree smoking's bad for you. It increases the risk of a lot of things, including cancer. Another point everybody agrees on, it's very difficult to quit smoking. Many people try a lot of times, and some people never are successful at it. There are hundreds of smoking cessation programs and lots of different views on their efficacy. I guess what I have to say about it is I think that, in fairness, efficacy depends upon two things. One is the smoker has to be ready to quit, and I have seen many people who their spouses gave them ultimatums and all kinds of things that have driven them to enter a smoking cessation program. I don't think you get very good outcomes that way. And then the other thing is the personality of the individual. I think that smoking programs have to be tailored for the person and choosing strategies that person believes will help. Well, since the year 2000, U.S. clinical practice guidelines have recommended pharmaceutical drugs for smokers who are trying to quit. All of them. Now, it's true that the drugs were proven to be effective in randomized trials conducted by the companies who make them. They have never been shown to be effective in studies conducted by groups associated with, who are not associated with or funded by the drug companies. One research group decided to determine the actual efficacy rates for Chantix, which is one of the best-selling drugs. You see it advertised on TV all the time. They did it by looking at longitudinal studies and controlling for factors that are not normally controlled for when people look at smoking cessation efficacy. And those are things like the fact that heavier smokers are more inclined to want to quit, but they find it more difficult to quit, whether or not the person's living in a smoke-free home, and smoking characteristics, like has the person tried to quit unsuccessfully before. Their analysis concluded that pharmaceutical drugs, specifically Chantix, do not help Americans to quit smoking. Now, this is very important in my opinion because Chantix causes side effects, some of them really quite serious. They include cardiovascular events like acute myocardial infarction, unstable angina, ischemic disease, ischemic stroke, heart failure, cardiac dysrhythmias, and peripheral vascular disease that has resulted in admissions to the hospital. Other side effects include nausea, which can persist for several months even after discontinuing the drug, stomach pain, indigestion, constipation, gas, vomiting, headaches, insomnia, and dry mouth. The most concerning issues with Chantix, however, are psychiatric side effects. In 2009, the FDA added a black box warning to the Chantix label, advising patients that they should stop the drug and seek help immediately if they experience agitation, hostility, depression, change in behavior, or develop suicidal ideation or behavior. And they were clear either while taking the drug or if having recently discontinued it. Well, Pfizer, in response to this, sent some new studies to the FDA showing that Chantix did not cause these problems. And they did comparisons with placebo and other methods of smoking cessation. The FDA noted that both of the trials that were submitted suffered from poor design issues, which included not having a big enough sample size and only reporting psychiatric events that required hospitalization and conveniently leaving out all of the rest of them. In spite of this, and this just blows my mind, on December 16th of 2016, the FDA voted to remove the black box warning on Chantix. The labeling still must state that post-marketing studies have included reports of serious neuropsychiatric adverse events, which include depression, mania, psychosis, hallucination, paranoia, delusions, homicidal ideation, aggression, hostility, agitation, anxiety, panic, suicidal ideation, suicide attempt, and completed suicide, but they took the black box warning off. Now, what's even more interesting about this is I went back and read what the FDA had considered. The justification for dropping the black box warning was the EAGLE study, which did show an increased risk of neuropsychiatric adverse events, but the increased risk was considered statistically insignificant. However, this study was one of the ones that was evaluated by the research group that determined that Chantix was useless for smoking cessation. So it's really hard to imagine why the FDA would continue to allow a drug that has been proven to be largely useless to remain on the market if it has any side effect for any human being who takes it. Well, we forget the FDA works for the drug companies, not for the American public. Now, it's likely true that some people quit smoking with Chantix and they don't have any serious side effects. The drug does not work for most people, however, and it can bring on dangerous side effects. Smokers should be made aware before they start taking this drug of the limited benefits and also the potential for very serious side effects. And they should also be made aware that there are many, many other strategies that they can try, and these include things like cognitive behavioral therapy, mindfulness training, and hypnosis. And there are no negative side effects from doing those types of things. So once again, a demonstration that FDA approved is virtually meaningless. And one more demonstration of who the FDA really protects. It's really protecting the interests of the drug companies, not the American public. All right, on that cheery note, that's all for today and all for the week, actually. Pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.